I think the chocolate cake is sneaking up on the carrots here. All right. 65-35. Interesting. Okay. Our next case. John asked me why rosebud. It's because there could be a stoma. So this is a 75-year-old female who presented with left lower quadrant pain and a white count of almost 20. At the time, her INR was 5.5. She had an initial CT scan, which demonstrated some evidence of perforated diverticulitis, but she didn't have a collection or an abscess at that point, so there's nothing to drain. So she was put on a course of piperacillin, tazobactam, TPN, and bowel rest, and one of the reasons why was because she also had AFib with RVR at that time. She did convert with IV diltiazem and then was maintained on oral diltiazem and a beta blocker and a heparin drip, so she was stable. She was still hospitalized 10 days later when she complained of worsening abdominal pain. And on her labs, her white blood cell count had again jumped up to about 18,000. So on physical examination, she had a pretty moderate obesity with a BMI of 41, the atrial fibrillation, and she was older, a little bit of dementia, but she was cared for by her family and she was still doing all right. In the past, she's had a laparoscopic cholecystectomy and an open appy, which was through a lower midline incision. And on examination, she's not quite tachycardic, her heart rate's 98. Her blood pressure is 129/66, and she has a low-grade temperature of 100.4. She indeed looks like an obese female, and she's very tender to palpation in the left lower quadrant. So here's some pictures of her redo CT scan, and I'm going to go back through this bit here and show you the important part. So as you can see, there's a collection which appears to be contained by a loop of small bowel. And then we'll show the sagittals here, maybe. Oop. This mouse is very... There it is. So her collection is contained by bowel, and your interventional radiologists tell you they can't access it. They don't have a window. They also tell you there's numerous diverticuli, and they do see that enlarging extraluminal collection, which is at least 6 centimeters. So she appears to have an abscess, potentially still a leak, and they can't get to it. Sounds like she needs to go to the operating room. You don't really, she's already failed conservative therapy. She's been on antibiotics for over a week, and she has a new collection. So what's the right thing to do? So you could go in and do a sigmoidectomy, put her back together if you're nervous, give her diversion. Or given that you have this 71-year-old lady with AFib, with significant medical comorbidities, you could do the safe thing and just go in and give her a Hartmann's procedure. This will be debated by 2 fine colorectal surgeons. We have Dr. Evie Karchin from the University of Wisconsin-Madison and Dr. Virginia Schaffer from Emory University in Atlanta, Georgia.